From Redfield Medical Direction, I'm Lynn Wynn, Associate Medical Director, and this is our EMS podcast, your link between protocols and practice.
Dr. Lynn, now imagine you're a medic, early morning, dense fog out, and you're on an interstate and there's a car wreck. So you get out of the back of your rig, all of a sudden you hear all this noise and you see a tractor trailer coming down, hitting cars, like a Final Destination movie. And all of a sudden you see somebody jump over the bridge. What would you do in that scenario?
I'm not sure what I would do, but we had two medics who were in that exact same situation and presented their case at our annual EMS case conference back in April. They won Best Ground EMS Case this year, and afterwards I was able to sit down with them to talk about the case. All right, so we have today with us two of our medics from Gadsden County who had a really interesting case recently. And gentlemen, if you don't mind introducing yourselves and telling us a little bit about what happened.
Hello, I'm Ty Kelly, paramedic with Gadsden County EMS. I've been with Gadsden for about 4 years now, and I've been a medic for about a year and a half. My name is Jonathan Whitmer. I'm also a paramedic with Gadsden County, and been with Gadsden for around 3 years, and I've been a medic for coming up on just about a year right now, so not too long.
So you're both relatively new.
Yep.
And it sounds like you had a pretty difficult case that even some of our more veteran medics would have a hard time with. Ty, why don't you start us out with what happened?
So, my morning started. Initially not this call. I was called for a respiratory shortness of breath. Lady who hadn't had dialysis in over a month. History of renal failure, fluid overload, and just let's go get dialysis at the Capitol. It was a really cold and rainy morning. I think it was just then starting spring. It was around 40 degrees and pouring rain. And so we picked her up and started heading towards the Capitol and got about the 187. And the 187's located on like a bridge, about a quarter-mile long bridge.
Yeah.
And my EMT just kind of yelled through the porthole, "Hey, we came up on a wreck, about 3-4 cars." I was like, "Okay, cool. I'll go get a head count if you want to just jump back here and watch the patient." My radio wasn't working, so I had to do it all through the truck. So I'd have to go out and check on it and come back. But the initial radio report was Med 2 were on scene of the 187. We got 3-4 car pile up. Just I need like 2 units. And so after that radio report, I just started checking on people and found a mother and her daughter. They were walking towards me on the shoulder side. We parked the ambulance on the shoulder side, and they said, "Hey, we're in this car over here." It was on the median. And like we were in that car over there, I look over, and I saw the husband and the 2 daughters, and I was like, "All right, well, let's get you in the ambulance." So we get her in the ambulance, or we're walking towards the ambulance, and I hear a semi not stopping, slamming on brakes, like screeching tires. This is coming through, and I turn around and I see it collide with the back of that vehicle. And they're freaking out, telling me that was the car they were in. And I was like, "All right, well, let's get you in the ambulance and then give me a head count."
Why were they stopped in the first place?
They were involved in the wreck. The mother and the kids were involved in the initial car accident. So their car was parked on the median.
Okay.
And I don't know if he was a lead vehicle or what, but he was not involved. He actually ended up just coming to check on the kids.
Gotcha.
And the mom and the daughter were walking over to come and get just a routine check. Of course, I checked with the patient that I had, my original patient. "Hey, there's a big accident. I might need to put people back here. Is that okay with you?" And thankfully, that patient was very understandable in the whole scenario and was like, "Whatever you need to do." So semi comes through. I didn't see the family after that. Said, "Hey, give me a head count." And so she said 3 daughters and my husband was over there. So as I was walking to the car, kind of just scanning through vehicles, make sure everyone's okay, and ended up getting to the vehicle. I found the 3 daughters in the back seat. Everyone was fine. Ended up carrying 2 of them, and one walks next to me. Able to answer all my questions. Just did a quick rapid assessment, just looking over them. They all were moving just fine. They weren't, obviously they were a little freaked out, but
Sure.
I think they were happy to see someone was there to help them.
Gotcha.
And so took them back to the ambulance. The wife was like, you see my husband? I prioritize on the kids first.
Yeah.
I'm gonna get to your husband now. So I looked everywhere. Under the semi, under the trailer of the semi, between the car and the semi, underneath the car, in between the barrier and the semi. And I could not find him anywhere.
Mm-hmm.
I just kind of happened to glance over at the railing
Mhm.
of the bridge.
Yeah.
And kind of had second thoughts of like, surely not. Surely this guy did not just jump. But sure enough, yeah. I found this little flashlight and I looked over and it reached him and he was just kind of sitting down there, sitting up. I was asked some basic questions of like, hey, you awake? Yeah. Are you all right? He goes, I think I broke my leg. And I had the stupid question of, are you hurting anywhere? Just a dumb question I should already know the answer to. The man just fell 60 feet, 45 to 60 feet. And he was like, yeah, I'm hurting everywhere. Like, yeah. So we ended up, I gave like a relay of everything, patient update, head count, patients. Luckily, I had already called for additional units. And so after I did that, Whitmer showed up pretty soon after. And so one of our other medics got the family, and then Whitmer got the dad. And so I just kind of gave basic bedside report of everything that I have information-wise.
And what'd you do when you get there, Whitmer?
So immediately I kind of tried to find a way. I knew that at this time everybody else was leaving. Unfortunately, we're a somewhat smaller county, and although on normal mornings at this time, one or two other a supervisor would usually be able to come help, but we had a BLS unit that was on another trauma call
Mm-hmm.
a little ways away, and that required the supervisor from that, and he ended up having to actually ride in with them. So it left only my truck available to continue to try to provide care for this patient. So we first tried to find a way down to the patient, and were not able to access them from one end. We kind of found that the terrain was too dangerous to be able to try to navigate our way down to him. So we worked with a couple of the volunteers and were able to find a rope to lower ourselves down, tie it off to a guardrail at the other end of the bridge and kind of lower ourselves down. But we're only able to bring really limited gear with us. So we brought a spine board, C-collar, and our jump bag, which we kind of thought initially, at least my thought process was, hey, this will be enough to at least kind of package him up and get him out from underneath the bridge.
So you got to the patient 60 feet down. What'd you see and what'd you do?
So initially when we found him, we noticed that we immediately tried to kind of expose his injuries with his clothing, remove his wet clothing. He had been laying out in the rain for around 30 minutes at this time, so immediately tried to get that off as quick as possible, get him onto the spine board just to move him out and move him. We moved him underneath of the bridge to get him out of the rain. And noted that he appeared to have, I'll start from the head. We had some minor head trauma. Like I said earlier, GCS of 15 still, ANO times 4. Some trauma around his left eye. Had some pain in his neck. His chest noted to have good lung sounds bilaterally. So I wasn't worried in the moment about a pneumothorax initially. He had massive bruising in around the thoracic cavity. Appeared to have multiple broken ribs and was having a hard time breathing kind of, but it really seemed to be more pain related, like a respiratory splinting type deal, than anything else. His abdomen was distended and warm, I would say, with some discoloration. He had pain in all 4 quadrants on his abdomen. Pelvis was stable, but he had bilateral femur fractures, open tib-fib fracture on the left leg, and massive deformity to both ankles. He had good PMS in the lower extremities though, so that was a nice thing. And he had what appeared to be a broken right humerus and as far as I could tell, maybe a broken right clavicle as well.
So it sounds like a very big trauma alert.
Yes.
What could you do given your limited resources?
So we immediately, like I said, tried to get him out of the cold. I knew that with him being out there in that weather for the last 30 minutes, hypothermia was a huge concern.
Mm-hmm.
So got all those wet clothes off, and started trying to cover him up with both survival blankets. I got some bystanders who had a blanket up above the bridge to throw the blanket down from above the bridge.
Nice.
And then one of the volunteer firemen actually gave his fire coat, his bunker coat, to us to have the patient lay on the patient's chest to try to help keep the patient warm as well. I immediately started large bore IVs, if I remember correctly, a 14 and a 16 gauge IV, and was like I said, at that point, I kind of was able to reassess vitals, but didn't have access to a lot of the other equipment that I would have liked to have been able to start being able to use, and meds and so on and so forth. But I was able to then just continue to try to reassess the patient, make contact with the USAR team, and try to coordinate that kind of extrication and make sure that the patient's condition was not worsening was the biggest issue for me at that time.
So what did USAR do when they got there?
They set up a ladder truck and were able to set up kind of a high angle rescue, and lowered down a Stokes basket to us, and we loaded the patient into the Stokes basket, kind of transferred care to that firefighter from Tallahassee Fire Department, and then I was able to walk back through the swamp area that we had went through, back up to the other side to where that incline was that we'd gone down with the rope, and we got ourselves out from underneath of the bridge to then go meet my partner Ty here, who had actually gone and dropped off his patient at the hospital that he was transporting to, and then had come back to the scene because my ambulance was stuck on the other side of the ladder truck on this bridge, and I was unable to get my ambulance past where they had set up their whole rigging system. So we loaded the patient into that ambulance that Ty had brought back with him, and immediately were able to get headed to TMH as a trauma alert and start providing that further care that we hadn't been able to do up until that point.
Gotcha. All right. So looking back on all this, it sounds like you did the best you could. Honestly, more than most people could, given the resources. What do you wish you could have done differently?
I think definitely getting to it would have been in a I guess ideal world, get to the patient a little bit quicker, and then really being able to bring down that med cell and the narcotic box with us would have been a great thing to be able to get things like the once we were able to get him into the ambulance to give Ansef for that open tib-fib fracture and the TXA, and really being able to get him on some oxygen and do those kind of things, and start to get some pain meds on board as well. That would have been nice to be able to do some of that under the bridge while we were sitting there waiting for this USAR team to be able to set up their extrication stuff.
Do you think blood products would have made it any different?
What were the initial vital signs?
The initial blood pressure, the first one that I got that I was really like, okay, I think he's like 110/60, somewhere around there. If I don't have my report right in front of me.
Yeah.
Heart rate was around 110 to 120. So it seemed like he was kind of losing blood somewhere maybe.
Yeah. Sounds based off the exam and the patient was tachycardic, which is usually the first sign of hemorrhagic shock. I think this would have been at least a good patient to consider pre-hospital blood transfusion for.
Yes.
Do you think there would have been any risk with him already being hypothermic and us having to keep our blood products cold?
Dr. Redfield will tell you that the only good paper about pre-hospital blood transfusion is the one out of New Orleans, and they were the ones that actually transfused non-warmed blood products. So,
Really?
yeah, when it comes to traumatic hemorrhage, what matters is keeping the volume up and getting the oxygen to the necessary organs is what's important. Obviously, warm blood will help with the core temperature, but in this case, what you need is just volume, and specifically blood as the volume. Well, I think you guys did a really good job, and congratulations on winning the HCA Crown case presentations today. And hopefully you guys will have another good case for us next year.
Well, thank you so much for letting us come and present our case with you guys. Yeah.
Absolutely. And that's all we have for today. This episode was a production of Redfield Medical Direction. Our theme music is by Infraction. As always, if you have any questions, feel free to reach out. See you next time.